Welcome back, everybody. We have a troubleshooter's warning about a big change affecting prescription medication, and chances are you've either taken a painkiller containing hydrocodone or might need one in the future. In 2012, doctors wrote more than 125 million prescriptions. But in less than 2 weeks, getting those pills will become much more difficult. Troubleshooter Jeff Stecker explains the new rules, which put relief at odds with addiction.
Beverly Schilke knows what pain is. She's lived with it every day for more than 40 years.
It's probably like somebody was taking a hot poker and sticking it at you all the time.
Back in 1970, a flesh-eating bacteria ravaged both of her legs, and she's endured over 200 surgeries since.
It's just ferocious. It just continues to go on and on until they can cut it out.
Beverly takes prescription-strength pain medication daily. It helps keep her mobile and enables her to volunteer with cancer patients at UConn Health Center, many of whom also depend on pain meds. And now it's going to be harder for all of them to get their prescriptions.
Only person that's going to hurt are those people who actually need the drug to survive every single day.
Starting October 6th, new federal regulations take effect for products containing the painkiller hydrocodone. It moves it from a Schedule III drug to a Schedule II drug, putting them in the same class as the painkiller oxycodone. Now, for patients, this means doctors will no longer be able to call in those prescriptions to pharmacies, and refills won't be allowed. And a new prescription will be needed every single time.
It is going to make it more difficult to obtain, and there are going to be more required visits, and there's going to have to be more interaction with providers. That's not necessarily a bad thing.
Jessica Hawkins is with the National Prevention Network. She is among the more than 700 drug addiction treatment professionals from across the country who gathered at the Connecticut Convention Center last week. Hawkins says the Drug Enforcement Agency's new regulations are recognition of what she calls epidemic levels of painkiller abuse.
We're seeing family medicine cabinets being stolen from. We're seeing young people diverting or stealing unwanted or unused prescriptions out of the home to other people. We're seeing people who are fraudulently obtaining prescription drugs from doctors' offices.
And according to the Centers for Disease Control, nearly 20,000 people die every year from abusing prescription painkillers. Healthcare providers agree it's a serious problem, but not everyone believes these regulations are the answer.
We certainly understand that we need to balance that with all the theft and diversion that has gone on with opioids in the country, but we think that there are maybe other ways that would be better able to handle that without decreasing access to patients who need pain medication.
Lisa Holle is a professor of pharmacy at UConn Health Center. She sees some cancer patients at UCHC who travel as far as 2 to 3 hours for treatment. Holle says getting written prescriptions for pain medication every time is a burden they shouldn't have to endure.
It really limits the ability of patients who need a medication quickly, a pain medication quickly, from being able to have access to it without having to come into a hospital or a clinic.
Legally, you can change schedules, you can, instill different mandates, etc., but I think it comes down to education and patient safety.
Dr. Eric Growling is a pain management specialist. He understands the DEA's decision to tighten the rules, but says educating prescribing physicians and patients would be a more effective tool. And he fears doctors already buried in paperwork and regulations may decide prescribing hydrocodone is too difficult, leaving patients in pain.
And some physicians may say, you know what, this is too much work. All these prescriptions that we were able to call in or fax in for the last years, now we have to do written prescriptions. They may not care to prescribe the medications.
Dr. Growling says patients who use these medications need to be talking to their physicians, pharmacists, and insurance companies right now to make sure they are prepared for these new rules.
Rules that Beverly Schilke says are going to make life harder for those who suffer with constant pain.
These people are going to be in a hurt. There's no two ways about it.
With the NBC Connecticut troubleshooters, I'm Jeff Stecker.